Well, thanks for staying with us on the program. Like I said earlier, every 31st day in the month of May annually, the world celebrates the World No Tobacco Day, a day set aside by the World Health Organization. The theme for this year's observance is Bright Products, Dark Intentions, Unmasking the Appeal. This is in line with highlighting the dangers of tobacco and nicotine addiction. Now, on the program, joining me this morning is a clinical pharmacist and a fellow of the West African Postgraduate College of Pharmacists. I'm talking about none other than Dr. Sunday Olatunde. Good morning to you, doctor, and welcome to the program.
Thank you very much for having me.
Now, let's get straight into the conversation. Over time, the adage smokers die young has been bandied about when we have the conversations on the dangers of tobacco. Now, beyond tobacco is the fact that nicotine is also seen as a drug and has some damaging effects on the health of individuals. As a clinical pharmacist, how do you view this year's awareness towards the dangers of tobacco?
Thank you very much once again for having me. The issues around tobacco has been a poison properly packaged in a way that is appealing to nearly all members of the society. And the theme of this year's World No Tobacco Day was actually apt in order to actually unmask the danger in smoking of nicotine. But before I go further into that, let's take a look at what nicotine is, because people feel nicotine is different from tobacco. But it's not true. The active ingredient in nicotine, in tobacco, is what we call nicotine. Therefore, if anybody smokes tobacco, whether in a powdered form or in the extract of it, what the person is getting into the body system is nicotine. And it is very important. Like I said, the theme this year is quite important because the unsuspecting members of the public are gradually getting used and normalizing, the use of tobacco. And when they see people doing it, they even don't feel any, they don't have any grudge against it, because the marketing companies, the companies that are producing these particular products, in a way are trying to make it a normal thing to us. However, we know that no matter what it is, those of us that cannot be deceived know that the poison that they market as though it is something attractive should be unveiled so that the public will know that there's a kind of secrecy that is going on without their knowledge, and there's a kind of consequences that we are already, all of us are victims of, which is issues of or cases of lung cancer and related cancers that tobacco use and nicotine can provoke in the body. So I think for me, the theme is quite apt for this year, and I like it.
Now, I'm talking about the harmful effects. You've mentioned lung cancer and other forms of cancers that smoking causes. The challenge with this is secondhand smoking as well. People who do not necessarily put the cigarette to mouth, but are in an environment where the primary smoker is also in.
Yes, you are correct.
How harmful is this as compared to primary smoking?
It is as harmful as the primary smoking. What happens is this: everything that the individual is getting, that's the primary smoking, is almost the same thing that the secondary smoker, that's the smokeless smoker. We call them smokeless smoker. They are not using the stick, but whatever the person is getting is what they are getting. There are two ways in which the harms or the harmful effect of nicotine use can be introduced into the body system. One is through the smoke. Of course, the soot that is coming from the smoking is dangerous to health, and that's the primary reason for lung cancer. At the same time, is the active ingredient nicotine that you are getting into the system, which becomes a drug on its own. And it's like when you pump drug into the system, you belabor every other organ that will need to handle that drug. For example, if you smoke tobacco, you get nicotine as a drug. Nicotine goes into the liver for metabolism to be broken down. After it is broken down, it is pushed to the blood. The blood circulates it and pushes it to the kidney. The kidney gets its own dose and try to eliminate it. But all the organs that will handle this drug inside the system, they are going to have an overdosage of it, and that can cause them some damages. So both ways, the smokeless smoker is getting the smoke, that's the soot that is coming, prone to lung cancer, like the person that is primarily smoking, and is equally getting some quantity of nicotine through the smoke as well, and by that is also close to having organ damages and organ failure. So as risky as it is to the primary smoker, the secondary smoker too is equally having the same risk.
Now, the question that comes to mind is, what efforts have we made as a country? But history would serve us right that in 2009, there was a National Tobacco Control Bill that was passed through legislature.
Yes.
In 2015, they had the National Tobacco Control Act.
Yes.
Now, but despite these laws and legislation, domesticating and enforcing it has been much of a hurdle. How do you see Nigeria progressing towards this no tobacco or tobacco-free communities with the provision of the law?
I can see that the government of Nigeria has not been quite serious about it. It's one thing to have a legislation. It's another thing to be able to enforce, to see to implementation of the legislation that you have. That piece of legislation has just been lying fallow without any, action, either to bite or to attack. I would like to actually encourage government to put that to use and to implement it as much as possible. The legislation came, in fact, also in 2015, there was a legislation that was prohibiting, public smoking. But these days, even on the street of Nigeria, on the street of Abuja, on the street of Lagos, you see people smoking by the corners, here and there, and nobody challenges them. Even the law enforcement agents are not challenging them. NDLEA is supposed to be in charge of that. Drug abuse and all that is in their purview. But I don't know whether what is happening, whether the legislation has not been well perfected or NDLEA has not actually had.
Well, I think for NDLEA, it seems as though they have prioritized what people consider as harder substances, cracking down on marijuana, codeine,
Yes.
and cocaine and the likes. Why do you think that it most seems as though cigarette smoking has been looked at as the lesser evil than those other ones?
And that's what we are seeing. People, when you don't understand the consequences and dangers inherent in a certain practice, you may likely underrate it. And that's why I say the theme of this year is actually apt and quite great. When we don't feel that common 1 stick, 2 stick, 3 sticks of a cigarette portends danger as much as heroin, as much as cocaine, as much as some very toxic opioid analgesics, you are likely going to underrate it. And that's what I think is happening to NDLEA. But you see, the incidences of lung cancer is more dangerous than what you probably see from all those other ones. And that's I would like that, and that's why I said the theme for this year is actually apt. Apt in the sense that, okay, when we do not know, we will not take action. And the WHO feels that this silent killer that is going on silently among us needs to be unmasked. We need to tell people that this thing they are marketing to us is actually a poison. It's doing more damages than those bigger ones. Because when somebody has lung cancer, just think about it. Apart from the fact that somebody has lung cancer, if the person will have to manage lung cancer, it's a lot to manage it. If the person cannot survive it, it's a lot in terms of social consequences of death. Because when a breadwinner of a family dies, most likely it's going to plunge that entire family into poverty. Because the breadwinner is gone. The children and the wife left behind, or whoever that is left behind, may not be able to live life confidently and comfortably. And when poverty happens, insecurity will follow. When insecurity comes, the entire society is at risk. So in such situation, we seem not to understand this particular poison that is being packaged in a way that is, attractive to the public. And I think the same thing is happening to NDLEA by prioritizing those other, other drugs, the one we can call hard drugs like cocaine, like heroin, like whatever you can call their name, all those other substances, over smoking of tobacco, that's a cigarette and all those other ones. Okay, if you do that kind of prioritization, because they don't know that this thing portends as much danger as those other ones, even in some cases more.
Now, we've raised awareness on the dangers of this drug.
Yes.
But let's also talk about the road to recovery. A lot of persons, not that they're not aware, they're not aware of the dangers of this addictive habit of smoking.
Yes.
But looking to make a U-turn and look for some sort of rehabilitation. Are there hopes that they can be rehabilitated? Or in terms of cleansing their organs internally, I've seen some people market substances that it does cleanse the lung and the internal system of smokers. How true is this? or into clinical practice under your field of expertise?
Thank you very much. And that will take us to principle of rehabilitation of addicts. Unfortunately, the government of Nigeria has not been doing quite well in addiction rehabilitation. Let's take a look at it this way. A drug addict is not a criminal. The individual is a victim of a system that is not working. And we know that, though it's not only in Nigeria, but you see, a drug addict is a victim of a system that is not working. Therefore, there is supposed to be a way of rehabilitating such a victim, because it is the fault of the state that such a person becomes addicted. Okay, a drug trafficker is a criminal. Let's try to clear that. A drug trafficker is a criminal. A drug addict is a victim. So, in getting this, the government needs to invest in rehabilitation. And let's take a look at the rehabilitation principle. It is, a multidisciplinary center that is supposed to be established either by faith-based organization, government, or even non-governmental organization. When in such a center, you have different types of professionals, and there are different methods of rehabilitation. For example, depending on which medicine or which substance, rather not medicine in this case, which substance is being abused by the abuser. When you get somebody that is addicted to a certain substance, first and foremost, you profile the person. Profiling is very important. Taking the age, taking the environment, the state of origin, where the person is from, the kind of family setting, and so on and so forth. It will help us to classify the addiction and possible reasons why the person is addicted to that kind of a substance. When you take proper profiling and you have got those information, in that you will know the type of substance that the individual is abusing. When you know the substance, then that determines the method you are going to apply in rehabilitating the person. But these are the available, methods that are available methods that can be deployed in rehabilitation. Number one, we'll take a look at gradual withdrawal. Gradual withdrawal is a situation or a method that we normally deploy when you want to engage in rehabilitating, let's say, opioid analgesic abuser. What happened is, in the course of abusing the drug, the brain reward system has been clearly, activated. It's a system, it's a site in the brain that reminds us of our sweet experiences, including drugs and other things such as sex, such as food, and so on and so forth. So the brain reward center has been clearly activated to get the person addicted, used to that drug. And if the person does not take it, he is going to have what we call a withdrawal symptom. And withdrawal symptom can be so bad that it can take the person to do anything to look for that drug. So you will not actually withdraw the person from the drug. If the person is doing, let's say, nicotine, for example, the same tobacco use, and at 10 sticks per day, you will not condemn. You will let the person take about 5 sticks a day. Or let's say you go to 8, from 10 to 8. By that, the brain will be getting used to 8 and be leaving 10, little by little. You will stay on that 8 for some time. After that, you reduce to 6. You are not condemning the person. Gradual withdrawal. Later, after like 3 months, the person has done 6, you go to 4. Because you are trying to switch the brain gradually to reduce the concentration of available nicotine in the system. And the brain is following you gradually. But if you stop the thing outrightly, that person is going to go into a withdrawal system that's going to be quite bad for individuals even to survive. Such a person can be so depressed and go and commit suicide. So you can do gradual withdrawal. As I said, you can do substitution. There is something we call addictive tendency of a drug or of a substance. Addictive tendency is that the potency that drug has to provoke the brain reward center to get the person addicted to the drug. Some drugs have very high addictive tendency that even at the first use of it, the person is addicted. But there are some drugs that maybe 5 to 10 times you use it, you are still not addicted yet. Okay, and there are some that before you do it 2 or 3 times, you get addicted. So in such situation, you do what you call substitution method. What is substitution method? The person is on a drug that is that has high addictive tendency, but in that same class, there are some other drugs that can do the same work. That you know, before a person goes to abuse a drug, there's expectation. That's what is deriving, what he or she is deriving from the drug. That which he or she is deriving is one. The use of the drug is another one.
Different.
So in such situation, you will now bring the one that has a lower addictive tendency, be giving it to the person. It will be deriving the same benefit, but you will be switching the brain from that strong addiction into the lower one. That's substitution. And by the time you feed that one, because the danger that this new one potent is not as strong as the danger that the old one potent. So you leave that person there. When he does that for a long time and the brain is used to this present one, you substitute with another one that is still lesser. By that, they will still be getting what they need to be. Let's say it's analgesic effect that is the major expectation. And all of them can provide analgesic effect. But the strength in which they get the brain addicted is different. So you try to be substituting like that. There are some other one that you call quarantine system style.
We'll get into that in the course of our next conversation and engagement with you.
Yes.
What I believe for now, we've looked at the dangers, we've looked at road to rehabilitation, we've considered substitution, gradual withdrawal. We also look at quarantine the next time we're looking to have this conversation. But we must thank you for taking out time to join the conversation on the program this morning. We do appreciate you.
Thank you very much for having me.